Yeah.
I mean, the SIENDO trial, it's coming forward in the very near term, as we know. I think the recruitment continues to move forward very much on track. It's an event-driven study, so we are looking to have the data by the end of this year. But if that does take a little bit longer, that may not be bad as well, because it means the events are being pushed out. But with regards to the trial and the data, maybe I'll turn to Jayden, who can touch on why we really are excited about SIENDO, the SIGN trial, in terms of what that showed us, and then what we're looking to show in the SIENDO trial. Jayden?
Yeah, no, thanks so much. And I think it's we're very excited about this specifically in endometrial cancer. And I think if we take a step back, I think this concept of maintenance therapy has been well established in gynecologic malignancies with PARP inhibitors in ovarian cancer. So it's in this space and context that we're talking about, where this concept has been well established and people are looking for a maintenance therapy in endometrial. We follow that up with the fact that there are no approved therapies in the setting of maintenance therapy in patients with endometrial cancer post-chemotherapy. So here's a space that they're comfortable with, and here's a space that they're looking for, but there is no data and there's no approved therapies. So then as we start focusing the space, in our initial phase 2 SIGN study, where we look at single-agent selinexor in patients with chemotherapy refractory disease with high disease burden that's growing, we showed that single-agent selinexor had an approximate PFS of 3 months, 2.8 months specifically. So we take that data and move into the SIENDO study, which is looking at maintenance therapy in patients in chemotherapy-sensitive disease and low disease burden, so patients in a CR or a PR. And in that setting, if we can have a median PFS improvement of 3 months, exactly what we saw in SIGN in later lines, and recapitulate that in the SIENDO study, and see an improvement from 4.5 months to 7.5 months, we have confidence from our early experience. This will translate over to the SIENDO study in patients that are chemotherapy sensitive. And so it's in this setting with a hazard ratio of 0.6 that we think that we're really optimistic. There's a real need, both from a physician and patient perspective, and a need that we can meet with the SIENDO study.
Could you characterize the market opportunity for endometriosis?
Yeah.